one of the reasons why NHS England in particular is so committed to the idea that we must use data that patients, as it were, provide as a byproduct of their experience of receiving care more wisely is because it has extraordinary potential to do three things, really. The first is to enable the improvement of outcomes in health and care. So if we understand more about the relationship between GP practices, let's say in a particular area, and local hospitals, patterns of care, patterns of behaviour, patterns of referral, we'll be able to do things like, for example, improve cancer diagnosis rates for cancer. At the moment, just to pick one example, we have a situation in England where very sadly we have some of the worst survival rates for cancer in Europe. And one of the reasons for that is because people are diagnosed with their illness relatively late in the cycle of getting it. And one of the things we need to understand really quickly and urgently is why that happens. And we can't understand that without much more available data link between the experience of the patient in general practice and the experience of the same patient in hospitals. So that's the first big reason that we need to have much more available data sharing. The second big reason is connected to the need that the system, the service, health and care locally, services have locally, to plan better for the future. The NHS is under considerable financial pressure. We know we've got rising demand for services from just an ageing population. People are living longer. What we need to be able to do is to make sure that they get the services they need when they need them, and try in a way to be more efficient about the way in which those services are provided. Again, for that, we need to understand much better what happens to people as they travel through the progress of their care, so that we can, in the future, look back at that data and plan better for them as they grow older. So second big benefit is around much more sophisticated, intelligent planning of local services. And then finally, really, we have the extraordinary opportunity in this country to ask our patients if they're willing to share their data for science. And this is really about the development of new medicines, new treatments that will take longer to come through. This is where we have to start thinking about our responsibility to the health service, not just for us today as patients or would-be patients, but for our children and for their children. And we want the NHS to be the cutting edge of science, to deliver new medicines and new treatments. And again, without this kind of linked data, what is known sometimes as real-world evidence, the pattern of what really happens to people when they are in their own real lives, we won't be able to develop accurately enough new ways of treating them in the future. We've, with our partners across the health and care system, both nationally and locally, have embarked on a really intensive conversation with all sorts of groups, people, local advocates, patient bodies and others, civil liberties groups, to try and work out how we can develop the programme in a way consistent with A, our commitment to confidentiality, and B, consistent with what I think is a very widespread view that this is absolutely critical to the future of a sustainable health service. So people want it to happen, we just need to get it happening in the right way. And as a result of which, we've, as I say, embarked on these, I think, very productive conversations, which have now led us to a new point. And that point is that we're going to launch this in a phased way, so we can be properly transparent about making sure that people do get the right information, that they feel they were properly informed of their rights, and equally that GPs are able to exercise their legal obligations in a way that they were clear about. And that finally, anyone then subsequently being given permission to access the data is doing so in an entirely transparent environment that's as secure as you or I would expect it to be as patients or citizens ourselves.